This morning we're going to talk about biohazard awareness. I'm going to start with a couple definitions. A biohazard is any viable infectious agent that presents a risk or potential risk to the well-being of people, including us. Biological agents are living things or substances produced by living things that can cause illness or disease in humans. Bloodborne pathogens are pathogenic microorganisms that are present in human blood and can cause disease in humans. These include hepatitis B, HIV, many other things that we're going to talk about. As we go forward, these things, in order of the way that we can acquire them, first is inhalation, breathing it in. Air droplets through the air, as you know, it's cold season, you hear people hacking. Should scare us a little bit maybe. Then ingestion, that's actually eating it or swallowing it. And then absorption through the skin. The most common, obviously for us, is inhalation. That's why we always tell people, cough into your elbow, because we don't want to inhale those kinds of things. In fact, I think we're a little worried that my daughter might have the flu, because she woke up with a fever this morning, so that would not be good. So they can also enter our system through open cuts, skin abrasions, dermatitis, mucous membranes. This is something we need to be aware of in our jobs, particularly those of us in custodial, because we deal with these kinds of things on a regular basis. One of the things that we're going to say over and over today is that we need to wash our hands well, often, and we need to use proper PPE. Wear your gloves anytime there's a chance you could be exposed. There's two kinds of transmission that we talk about when we're talking about these kind of hazards, and that's direct transmission and indirect transmission. First is direct transmission, when there's actual physical contact between an infected person and someone else. Indirect transmission is when those infectious materials attach themselves to something else and then you touch it. For instance, if I was holding my coffee cup, I cough on it, you decide I really need some caffeine, and then you touch it, that would be indirect transmission. It can also happen when an insect or just is transmitted through the air. So we're going to talk about, excuse me, I'm going to cough right into the microphone. Sorry for all the people who watch this video. We're going to start with HIV and AIDS. We're going to talk about 8 different kinds of biohazards today. But the first is HIV. It's human immunodeficiency virus, which can lead to AIDS, acquired immune deficiency syndrome. It is transmitted from an infected person by body fluids, such as blood, urine, semen, or other blood-containing secretions. Though HIV can be treated, there's no cure. So you don't want to get it. You want to limit your exposure. HIV is thought to be the cause of AIDS, and what it does is it attacks your immune system. So it doesn't actually kill you, but it makes it so other things can. There are more than 1 million people in the U.S. who are living with HIV, and approximately 50,000 people each year become infected. There's some numbers for our area. Over 3,000 in Dallas, about 69,000 in Texas, just this past year. So to prevention, biggest thing, always use your PPE. Custodians in particular, when you're cleaning bathrooms, wear your gloves. Throw your gloves away when you're done with them. Change them often. There is medication that may reduce the chance of becoming HIV positive, but that's only a maybe. You want to avoid your exposure if you can. So use your PPE. Next up is we're going to cover 3 different kinds of hepatitis.
Where on campus would someone be most likely to encounter like something like HIV? Because obviously we all think it's only sexually transmitted.
Right. Probably the biggest one would be restrooms.
The needle
Or
boxes
or
and
if
that.
or if there is some kind of an emergency where there's blood somewhere, somebody vomits. Things like that have been known to happen. Those are our most significant areas of exposure, but it's wise to be aware.
Because you guys empty the sharps containers, right? Like the needles
We
and all that stuff.
if we come across it, we do it, but then we turn it over. Is that correct?
Yeah, we don't.
We don't.
We'd have somebody come pick them up and empty
Yeah.
it. We don't empty it.
Yeah. So we're going to just keep talking about hepatitis. What's that?
On a couple of screens ago where it said 13 plus on there, if anyone was curious what that was, that's ages 13 and up. They have different issues when we're talking about ages 12 and below for gaining stats. It's a little more difficult because of privacy factors.
We've got all kinds of letters, A, B, C, D, delta factor, and E. We're going to talk about 3 in particular, A, B, and C, today. Possible symptoms for hepatitis include tiredness, loss of appetite, fever, diarrhea, dark urine, light-colored stools, jaundice, and then stomach ache for hepatitis A and C. Now, what is hepatitis? What's that? What is that? Those of you who had Latin or whatever.
Inflammation of the liver.
It's liver disease, and there's several different kinds. They all have similar symptoms, maybe in different degrees. Numbers of people who are infected with these diseases has dramatically decreased in our country in the last 10 to 15 years, as hepatitis A and hepatitis B vaccines have become very common. Kids get them right off the bat when they're born. My daughter got her first hepatitis B shot before she left the hospital a year and a half ago. I didn't get my shots until I was 15 or 16 when I was going to leave the country, and for some of us it was even later. But that has dramatically decreased the incidence of these diseases. They are safe and effective, these vaccines. If you have not been vaccinated, check with your doctor about getting it. We do have a slight chance of exposure to these diseases. There are some ways to prevent HIV infection other than PPE, washing your hands, those kinds of things. One is that an immune globulin preparation that contains Hep A antibodies can be used before, if you know you're going to be exposed, for sure, and within 2 weeks of exposure to prevent infection. There's also a particular kind of vaccine that can be administered after exposure, up to 2 weeks after exposure. Once again, better not to be exposed. Particular ways to prevent HIV infection is to wash your hands after using the toilet or changing a diaper, and before preparing or eating food. Wear gloves if you have to clean surfaces contaminated with stool, for example, diaper changing tables, toilets, those kinds of things. Now, hepatitis B is actually 100 times more infectious than HIV, the virus that causes AIDS. About 5% of Americans have been infected with HBV at some point. People who get infected with HBV can also get infected with hepatitis D, and that combination is really bad. There's acute diseases. That's when you first get it, new, it's bad. Typically you get over it. There's also chronic hepatitis. Hepatitis B is one of these that can become chronic. There's approximately 1.4 million people living in the U.S. that have chronic hepatitis B. They might not look or feel sick at all, but they are carriers. They can spread the disease to others. About 15 to 25% of people with chronic hepatitis B will probably die from cirrhosis or liver cancer. There's also, like I said, there's a vaccine for hepatitis B that's usually given as 3 shots over a 4 to 6 month period. And there's also a 2-shot schedule for younger 11 to 15-year-olds. But it's also, like I said, it's given to very, very young children nowadays, and that has caused the number of incidents of this disease to decrease dramatically. The vaccines last at least 15 years. Hepatitis C, there's approximately 4 million Americans are infected with hepatitis C virus. And 16,627 Americans died from HCV-related illness in 2010. Chronic liver disease caused by hepatitis C is the #1 reason for liver transplants in the U.S. Now, how do you get these? Hep A can be transmitted through feces, excuse me. But Hep B and Hep C are found in blood and body fluids. The average incubation period between initial exposure to the time of showing symptoms for Hep B is 16 weeks approximately, and somewhere between 7 and 9 weeks for Hep C. Hep B and Hep C can spread through injection drug use. People sharing needles when they do drugs and stuff like that, but also through contaminated needles that have nothing to do with drugs. It can spread through sex with an infected person, through sharing personal care items that might have blood on them, through contaminated tools for tattooing and body piercing. It can also spread from an infected mother to her child at birth. And the most significant for us is from not using proper PPE when we are doing things where we might be exposed to these kinds of things. There is no treatment for a new infection, Hep B or Hep C. For chronic disease, there are antiviral medications, but they're only about 50% effective. So it is much better to not be exposed. And eventually, for many of these, liver transplant is required. For us, one of the things that we have as an opportunity at DTS, if you have not had your Hep B shots, you can get them. Most of you, when you're hired, probably have that option. If you have not had those shots, particularly if you're custodial, I would say you should get them.
Daniel,
Yes.
if you are ever exposed to hepatitis B and you're concerned about your protection, there is a blood test that can be done to see whether or not you have enough protection from your vaccinations to help you, or if they need to give you an additional vaccination.
That's good. If you would like more information about any of this stuff, the CDC's got all kinds of information about hepatitis. Kind of a quick review of those though. Hepatitis A is transmitted by contact with infected feces or contaminated water. There is no chronic or long-term damage from Hep A. It is usually not fatal. Prevention is immunization, and then use of proper PPE. The number of cases of Hep A has dramatically decreased. I've got from 2007 there were 25,000 new cases, and they estimated in 2011 that there were only 3,000 new cases in the U.S. However, because it is transmitted through feces, it is slightly higher risk for us than it would be than Hep B or Hep C would be, just because of the way it's transmitted. Hep B is transmitted through blood and body fluids. Chronic long-term effects. You could very well die from it. Prevention, again, is immunization and proper PPE. There were 18,000 estimated new cases in 2011 in the U.S. Hep C is transmitted through bodily fluids, mostly through contaminated needles. Has mostly chronic long-term effects, and the cure, the drug cocktail, is like I said, only about 50% effective. There were 16,000 estimated new cases in 2011. So but because of the way it's transmitted, the risk is not as much as the other two. Something that is much more of a worry for us, that we're going to get to next, is influenza, the flu. It is transmitted through the air from exposure to cough, sneezes, or other tiny droplets coming from an infected person up to about 6 feet away. It is less often transmitted by touching a contaminated surface or object and then touching the mouth or nose. Adults may be contagious with the flu 1 day before symptoms and 5 to 7 days after becoming sick. Children may even be contagious longer than the 7-day period. Symptoms typically start 1 to 4 days after infection. You may be able to pass on the flu before you know that you are sick, even obviously while you're sick. And some people may be contagious without any symptoms at all. Symptoms include fever, feeling feverish or chills. Some people who have the flu do not have fever. That's like one of our telltale signs, but occasionally people have the flu without a fever. Other symptoms include cough, sore throat, runny or stuffy nose, muscle or body aches, headaches, fatigue, very, very tired. If you've ever had the flu, you know what I'm talking about. Vomiting and diarrhea is a possible symptom, but that's more common in children. So, prevention. Get your flu shot. Stay away from sick people. Some of us in our homes, that's a little bit hard. Do our best, because they can transmit the disease to you. If you are sick, stay home. Don't come to work. Don't get everybody else sick. Biggest thing is wash your hands with soap and water. That was perfect timing right there.
It's called allergy.
Yeah, we know. Wash your hands often with soap and water. Most of our restrooms on campus have hand washing instructions next to the sink. Wash them long enough with the correct procedures. If soap and water are not available, use an alcohol-based hand sanitizer. We have hand sanitizer stations all over campus. And then also clean and disinfect frequently touched surfaces. That's why we clean our bathrooms every day. A lot of our surfaces on campus get cleaned very frequently. You can see in this map how much of the country, as of about 6 weeks ago, had very high levels of flu. So, wash your hands, use your PPE. The next one we're going to cover is tuberculosis. It is transmitted through the air from exposure to cough, sneezes, or other tiny droplets coming from the lungs of an infected person. It can be treated very effectively. Prevention includes yearly testing. You ever got those little bubble tests in your skin? And general awareness of those around you. Symptoms can include a bad cough that lasts 3 weeks or longer, pain in the chest, coughing up blood or sputum, weakness or fatigue, weight loss, no appetite, chills, fever, sweating at night. Another kind of biohazard that we encounter is molds. Now, one of the things that we have to remember is that the presence of mold does not always indicate a health problem. Molds produce mycotoxins which are toxic to humans and can, over time, wear down the immune system to produce allergic or respiratory problems, some of these quite severe. Prevention of molds includes keeping moisture from remaining in buildings. We have about a 72-hour window when something gets wet to get it dry before mold starts growing. So if you encounter a wet spot that's not going to dry on its own, you need to deal with it. We have those high-powered fans. We can dry it quickly if we know about it. And also to periodically do a visual inspection. Just be aware of the facility. If you see something that needs attention, communicate it. And when it is discovered, it should be dealt with as soon as possible. The other one that's a significant issue for everyone is the common cold. There's over 200 viruses that can cause the common cold. It is transmitted by getting into the nose where it infects the membranes. If it's not properly treated, it can directly cause laryngitis, tracheitis, bronchitis, sinusitis, pneumonitis. It's not fatal, but it severely affects performance and absenteeism. 61 million cases of the common cold a year. People get an average of 4 colds a year. You're going to get sick. It's probably going to happen. Way to prevent it: wash your hands, be aware of those around you, try to stay away from sick people, use your PPE. Cough into your elbow, not on your hands. Alright, some basic preventive measures for most of these. Just simply be aware of potential exposure. Know where you are and what people are doing in those areas. Treat any body fluids you encounter as if they are infectious and avoid direct skin contact with them. Use proper PPE if touching anything that could contain body fluids. Use non-absorbent gloves, either latex or nylon, vinyl that we have in custodial. Use eye protection if there's a potential for droplets. Even when you're treating a skin knee, there's potential exposure to these diseases. Wear your gloves. Wash your hands thoroughly and often. Properly dispose of any blood-covered items into bags or containers that are labeled for disposing biohazardous materials. Use disinfectants that are labeled for these kinds of things. A disinfectant that claims to kill TB can be used to clean areas that are suspected with Hep B or HIV. If you have an emergency where you have blood, body fluids, those kinds of things, if it's a medical emergency, call 911. Forget it. Do we call Campus Police first, right? Then we'll get 911 called. But call Campus Police if there is a medical emergency in these areas. Use proper barriers to limit your exposure to bloodborne pathogens if you're offering assistance. Biggest thing, use gloves. Wash your hands after cleaning up an accident site, even if you did wear gloves. Properly dispose of blood-covered items in bags or containers that are labeled for disposal of biohazardous material. We have a bin over at the FBO yard area that's labeled for biohazardous materials, and if we have something like that occur, we'll have somebody come pick it up. And if you feel you have been exposed to bloodborne pathogens or during a workplace accident, report the incident to your supervisor immediately. Some of these things can be dealt with after exposure, but only if it's dealt with quickly. So it's important to notify your supervisor so we can deal with it quickly.